When people hear heart surgery, most of them think about bypass surgery. But here's the truth: your heart can fail even if the arteries are normal. Then what is the problem? The problem is another part of the heart, also known as the valves. Imagine your heart to be a big house with 4 rooms. Each of these rooms is protected by a one-way door, and this main house has a main gate. If the door or the gate gets jammed, then it causes problem to the house. In this video, I'll be talking about one of the most important valves of this heart and its diseases, the aortic valve. Your heart is like a pump, and this pump has an exit door. Imagine this exit door getting jammed. This is exactly what happens in aortic valve disease, and this can be life threatening. Let's break it down simply. The aortic valve is your final checkpoint in the heart before the blood leaves the heart to supply the rest of the body. It is usually made up of 3 and sometimes 2 doors, also known as aortic leaflets. Every beat depends upon its proper opening and closing. On an average, the normal human heart beats 60 to 90 times in 1 minute. So imagine this gate opening and closing 60 times in a minute, and this has to be repeated for decades. It is normal that in few people, this door or the gate can get jammed or can come loose. The commonest reasons being rheumatic heart disease, that is, if you have had a history of fever and joint pain as a kid, or degenerative, that is, due to old age. Let's talk about the diseases. The valve itself becomes tough and stiff and doesn't open properly. Because of this, there is obstruction to the blood flow coming out of the heart. This increases the pressure inside the heart itself and causes the heart muscle to weaken. As the blood flow coming out of the heart reduces, the patients start developing various symptoms. Aortic regurgitation. In this, the valve starts leaking, that is, the door doesn't close properly, because of which there is backflow of the blood into the heart. This again increases the pressure inside the heart and eventually causes it to fail. The most common and classic symptoms include chest pain, breathlessness, and fainting spells. Here's the important part. Once the symptoms start, surgery is often necessary and one of the best treatment options. Unlike other valves like the mitral valve, aortic valve is more often replaced than repaired. Why? Because it is structurally little difficult as compared to mitral valve to repair this, and the repair may also not last for a longer time. So most commonly, a patient needs a new valve. First, mechanical valve. These mechanical valves are made up of metals like pyrolytic carbon, titanium, etc. They are very durable and can last a lifetime if maintained properly. They are comparatively cheaper. They are ideal for younger patients, generally less than 55 years of age. Disadvantages: a patient needs to have blood thinning medication for the rest of his life. Bioprosthetic valves are made up of animal tissue, namely bovine or cow and porcine or from pig. Advantages: no long-term anticoagulation required, only for a specific period of 3 to 6 months. These are more lifestyle friendly. Disadvantages: the lifespan of bioprosthetic valves is lesser as compared to the mechanical valves. The best choice of a valve differs from patient to patient. This decision has to be taken after discussing with your heart doctor carefully. For some patients, especially elderly or very high risk patients, these valves can be changed without opening your chest and can be done via catheter-based technique known as TAVI or TAVI. Yes, heart replacement using a catheter. Modern medicine has come a long way. So next time when someone says heart surgery, don't just think about bypass. It's not just all about blockages. Sometimes it's about fixing the main gate itself. And when done at the right time, it not just adds years to your life, but it adds life to your years. If you like this video, please share it with your loved ones. Subscribe for more heart related content made easy, because I believe heart related education should spread faster than the heart disease itself. Thank you.